everyone. I'm John Evans. Welcome to another episode of One-on-One. Dr. Mandy Cohen has become a regular fixture on TV newscasts across the state of North Carolina since about the beginning of March. As the Secretary of North Carolina's Department of Health and Human Services, she is the face of the state's effort to control the spread of COVID-19. This is not her first healthcare crisis. In Washington, D.C., Dr. Cohen worked to improve Medicare and to repair the healthcare.gov website. Since Governor Roy Cooper appointed her as Secretary of the DHHS in 2017, Dr. Cohen secured funding in the fight against the opioid epidemic, and she worked to get rid of Gen X in our drinking water. But now she is working to keep 10 million people safe from the coronavirus, while finding the time to be a wife and a mom to 2 young daughters. Dr. Mandy Cohen, Secretary of the North Carolina Department of Health and Human Services, internal medicine physician, wife, mom, and in 2019 named top 25 women leaders in healthcare by Modern Healthcare magazine. Welcome to the One-on-One with John Evans podcast.
Well, John, great to be on. Thanks for having me.
I had to cut down your introduction so we actually had time for a conversation here.
You're very kind. I have had a very expensive but very incredible education and opportunity to now be here in North Carolina. It's great.
Do you still sometimes, Dr. Cohen, shake your head that this is 2020 with the medical advances we have and the technological advances we have, that a virus literally has brought this world to its knees?
Yeah, isn't it incredible? I feel like it's almost trite to say we are in unprecedented times, but it is an incredible time that I think I still need a little distance from. We're in the moment here to really think about how did we get here? Could we have prevented this? How do we get better from here and learn from this clearly? But yes, we do have such an incredible healthcare system, but it's amazing. This little tiny virus can really devastate things. And I think it's showing all the cracks in our system. We have a very, a patchwork quilt of a healthcare system with unequal access. And we have holes in our ability to respond. And I think this virus is exploiting those cracks that we already had in the system.
Do you remember, Dr. Cohen, where you were when you first heard of COVID-19? When was that uh-oh moment for Mandy Cohen in this whole thing?
Yeah, I had heard about, that China was dealing with it and in Wuhan, but it wasn't until I saw the video that went viral when the Chinese government in Wuhan put up a hospital in 10 days from the ground up. Like, it went from 0 to hospital in 10 days. And I said, right, that if they need to do that kind of effort to put an entire hospital up, like, this is serious. This is going to be on our shores, and let's get ready for it to be here. I mean, we were already in that monitoring and reactive mode, considering, do we have cases here? But when I saw that, I thought, this isn't your everyday respond to a virus. This is something different that we're going to have to be doing. It was quite dramatic.
I know from my small time of experience in healthcare, I worked for a year in between the 2 TV stations I worked at, and I know there are drills to deal with certain things.
Yep.
But in your career in public policy, was dealing with a pandemic ever on your radar?
Well, so I've largely not been exclusively in the public health space. Like, a lot of my leadership has been in the payer space, the government payer space. I worked for Medicare and Medicaid and the marketplaces at the federal level. And then here, I have the opportunity to lead a large department. Public health is part of that, but also mental health and Medicaid and human services. And so it is a piece of my work. And I do have a master's in public health. But this is certainly something that I could not have anticipated. I don't think anyone could, but I do feel, lucky that I have a background as a physician. I have opportunity of leading complex organizations in healthcare, and I've been I've led through crisis before at the federal level. So you put that together, and I think I can bring some valuable skills here. But I lean on a lot of people, right? I'm not an epidemiologist. I need to lean on my scientific team, my operational team. So it is a huge team effort, though folks see me all the time. It is a massive team that is running hard every day to help us respond to this.
And that's my question, is that you've been in our newscast better part now of 3 months. And so who does Mandy Cohen turn to with confidence? People are looking to you and they're saying, Dr. Cohen, can we open up? Dr. Cohen, do we need to wear masks? But who does Mandy Cohen go to and say, okay, I trust that person, or I'm confident in what that person tells me?
Yeah, so first I start with my team. We have great folks here in North Carolina that are epidemiology experts, scientist experts, physician experts, but also operational experts. And so I rely on my team, whether that's Dr. Betsy Tilson, who is our state health director, Zach Moore, who's our state epidemiologist, and then an entire team that sits behind that of scientists. My deputy secretaries, Susan Perry and Cody Kinsley, are amazing and are just really organizing the work for us. But then there are external people. For example, I'm in close contact with all of the CEOs of the major hospital systems in our state, right? This has to be an all hands effort. So I'm in touch with them continuously, other senior scientists across North Carolina and frankly around the country. I have had the opportunity to work at the federal level, have a lot of contacts through my former work. So I am reading constantly. I'm reaching out to them constantly. I particularly look to the leadership of, for example, the former FDA director, Scott Gottlieb, Mark McClellan here, who's here in North Carolina. They've been excellent. Former boss and mentor of mine, Andy Slavitt. And there are many folks that I have the opportunity, luckily, to look towards. Tom Frieden also used to run the CDC. I'll say also in North Carolina, we're very lucky is that that Bill Roper, who is now the interim chancellor of the UNC schools, was the former head of the CDC. Right. I mean, how lucky are we, right? So he's been, someone I turn to and to bounce ideas off of. I have to talk to the business community a lot, right? Because there is a lot of art here. There's science, and then there's art, and we have to understand how this is impacting business and the economy. So I talk to business leaders all the time. I want to hear their concerns because we have to take in the full picture here. So yes, it's heavy science, got to be driven by the numbers. But this is bigger than just the science. We have to find this right balance here. So I interact with a lot of members of the business community, the chamber, et cetera. So I try to take in as much information as I can.
You've been around politics for a while too. You were at the Centers for Medicare and Medicare Services. You were with the Federal Health Insurance Marketplace. So you're not new to politics. But do you get at times frustrated that something like this is being politicized, no matter what side it's on? It is still being politicized, not just here, but in D.C. and really all around the world.
I think that is a challenge of this virus, and I think though that look, North Carolina is a purple state. I think we need to find the solutions that make sense for North Carolina and understand that people have different viewpoints of the world. That is our reality, and so it's a matter of how do we find that balance, help folks understand where each of us is coming from. I don't think anyone it means malice, like right to the other side, but we definitely have different viewpoints of the world, and it's been so interesting to me to see how everyone has different risk tolerances, right? There's some people who will take a lot of risk, and there are others who are very risk averse, and that plays out in very interesting ways in how they're interpreting risk of this virus. There's some people who see, the 1,000 deaths that we have and go, wow, that is triple the worst flu season we have. And others are like, 1,000 deaths? We have 10 million people here in North Carolina. Both of those statements are accurate. 1,000 people, we have 10 million, and this is triple the worst flu season. So both of those statements are accurate, and they just are different ways of people viewing the same situation. And so we're just trying to figure out how do we stay true to like that, what I said, the science and the data, but understand the larger context of business and the economy, right? This is hard. this is hard.
Yeah, it is.
And we don't know the perfect right answer here. And we're trying to do the best we can to balance all of those different competing forces.
Anything brought you to tears?
I've cried, but there's may have been some tears, and right, it's just because these are excruciating decisions. None of them are easy, right? When you are making decisions about whether or not you can open businesses or even keep restrictions, and someone will tell you a heart-wrenching story of how they built their business, and oh, it's awful. Or I will share a moment that happened in our press conference yesterday when a reporter shared about her own father.
Good afternoon, Governor and Dr. Cohen. Thank you so much for taking my question. This is Kate Martin with Carolina Public Press. This is regarding homes and rehabilitation facilities that they claim to have no positive cases. And I want to be clear, I understand that you've got a plan to test everybody, but I have a question about the ones that say that they have no positive cases. Readers have contacted me who are concerned about their loved ones, and they've said that the facilities are not saying whether those facilities are even testing residents and staff. I've asked DHHS on their behalf, who told me to talk with the county health department, and the counties told me to talk to the facilities. The facilities instead meet these questions with how clean their facilities are and what the testing protocols are, but they're not actually answering whether they're testing anybody. As a journalist, I find this puzzling, and just in the interest of full disclosure, my father died last month in Kansas in a facility, and they won't tell me whether they were testing anybody. So I want to know, does DHHS know whether nursing homes without reported infections are actually testing their staff and residents, and how many of those tests are actually being performed? If not, please tell me why, and do you think this is acceptable if you don't know? Thank you.
Kate, so sorry to hear about your dad.
And she's asking questions about a really important intervention, for testing, but this is personal. This is really, that really affected me, and I know that it affects my team when they hear that, because it puts a face on that all of the decisions we're making are so hard, and they do mean so much to folks. And so there have been some really hard moments. They're hard moments.
I was listening to Kate yesterday when she asked that question, and it took me aback. I had to take a deep breath, because she's working through this, and you can tell she was trying to be a journalist, but she had lost her father to this. That was one of those things that it made me stop for a second. I'm sure it had to make you and the governor and everybody else up on that stage do the same thing.
Absolutely. I thought it was incredibly brave of her to bring that vulnerability and to share that personal experience in the context of a question. And I reached out to her after to thank her for doing that, because I think it is important that we remember the people behind all of this. We throw around numbers and we forget that these are families with real loss, and that the actions of whether it's testing or doing protective equipment, right, we can get lost in the terms of it, and you forget how personal this is. So that I thought that was a really important and powerful moment.
You're the secretary of the NCDHHS at a time of a worldwide pandemic. You're also a wife, and you're also a mom. How are you balancing all that, Dr. Cohen?
Well, first, I have the greatest husband on earth who has picked up a lot of the home front. And so I want to give a shout out to my wonderful husband. And this is what great relationships are, is that sometimes one person is really busy and the other, is able to step in. And so he has taken, I used to be the food shopper and cook of the family. I haven't done that since March. So I appreciate that he has taken that over. He's handling all the kids' school stuff, right? And so you need a partner in to help you through this. And so I'm very lucky for that. We're lucky. We have girls that are 5 and 8, so it's kindergarten and second grade. And I think that they are old enough to understand what is going on, but they're not teenagers, so that they're not missing their friends in the same sort of intensity that I hear from my friends who have teenagers. So they've really weathered this really well. So I feel really lucky from that perspective that they have done well, because if they weren't doing well and I had to think about that every day at work, I think that would have been really hard. So we're very I consider ourselves very lucky. I think it's an honor to serve in this role. I think it's great for my girls to see that sometimes mom has to be really busy and lead and to work hard on behalf of making the world a little bit better every day. So I think it's a good lesson for them.
But you just said yourself, they're 5 and they're 8. And I imagine your days are long. I imagine there's work at home, at night, and in the mornings. So as you're trying to be strong and lead 10 million people, are there those things in the back that, boy, I hope I don't miss one of those enlightening times of a 5-year-old and an 8-year-old?
Well, I try when I am home to make sure that I'm very present there. So the hardest, I think, for all working parents is that when you're trying to work and you're trying to parent in the moment. And so someone gave me good advice long ago, is that don't try to do both at the same time, is like make the time for work, even if you're home, but just like make it separate, even have a physical space for that. And then leave that physical space and like be with your kids. Mm-hmm. And I don't get that perfect every time, because I think the work in truth.
Parents, you never get anything perfect when you're a parent.
Yeah.
Believe me, yeah.
So that's aspirational, but I think I try to be more present for them and just find the moments to connect with them through all of this. And I'm doing the best I can.
We all do the best we can as a parent. You grew up in New York State. Where did the interest come in medicine?
Yes, my whole family are still in New York. Shout out, hi, everyone is still in New York. But my mom is a nurse practitioner, has been her whole career. She's an incredible clinician, and she's worked in an emergency room nearly all her career. And it's really through her eyes that I saw both the good and the bad of the healthcare system, right? The cracks of our system show up in the emergency room, but also the wonderfulness of watching my mom get stopped in the grocery store saying, "Oh, thank you so much for, helping my mom or my sister," whatever, right? And that you touch someone's life at a critical time, but also that healthcare is so critical for us to be able to do other things. And I always knew going into healthcare that I wanted to be part of making it better, because I saw those cracks through my mom's work and her eyes. And so I always sort of had this idea that I wanted to go into clinical work, but I really wanted to think about how can we make the system better. And this is the nature of the job that I do right now.
Well, I grew up with a father who was a small town doctor who did everything from deliver your baby to set your broken arm.
Oh,
He was the one, I remember going on house calls with him with his little black bag, and he would walk in. And in the 60s and 70s, some of the families would pay him with food or bottles of wine. It sure has changed since I watched him do that and be that person that was stopped by his patients. When did your direction change to get into more of the public policy, though?
That was something early on that I was very interested in. Even while I was in college, before I went to medical school, I worked on Capitol Hill and sort of got an interaction of how does the policy interact with the clinical practice. And so I had a couple of mentors early on who really encouraged that idea of building the bridge between clinical medicine and policy. So I went from, had an experience in Washington, D.C., finished up college, went to medical school, and sort of always found opportunities to bring the two together. And so I've just been lucky to then carve a career path out that allowed me to continue that.
Okay, I've got to ask you here. You tried to tackle Medicare. You were in there with the federal health insurance marketplace that, let's face it, didn't get off to the greatest start in the world.
No.
You dealt with Gen X in North Carolina. You've dealt now with the pandemic in North Carolina. At any point in time, as Mandy Cohen was driving to work, did you go, wow, maybe I should have just been an internal medicine doctor somewhere and it would be a lot easier than it is now?
Well, I would say my internal medicine colleagues would say that's a really hard job. And so being in primary care and that kind of workload where you have to be, you're making some life and death decisions all the time, like that is hard in its own way. But I do seem to find my way to some crisis situations. I might need to re-examine this, John. But I think it's because I've had the opportunity where folks have let me lead at important moments and have helped me build my career. And they have been around moments of crisis. That's where my career leaped forward at the federal level, was to help sort of healthcare.gov and Obamacare sort of kind of get back on track, which we did. And but that was hard work and very tense time. So I hope to be able to bring some of the lessons learned from past crises into this one. And look, one of the big ones that I took away was you got to communicate a lot, right? And that's why I hope folks hear from me a lot. And I think it's really important, but also to be transparent with our data. It's why we spend a lot of time getting as much data as we can on our dashboard. Again, it's not perfect because the way we collect data is not perfect, but communication and transparency, I think, are core to being able to respond in a crisis.
Okay, as a human being now, what was the coolest thing about being around the White House?
I mean, there's so much history there. So you feel special just being in the aura of what that place is. And and the history and you just look on the picture of the walls. And, before I was a fan of all things that were government, and before I even went there, and from the movies and what have you. So it's a very special place. And then I had the opportunity to work for a president that I was very inspired by, President Obama, and that was an incredible opportunity to work closely with him and his team to feel like we were making gains in the healthcare space there. And I was glad to then have the opportunity to also work for, a leader like Governor Cooper, who I see so many like similar traits of the thoughtfulness, really, really trying to find the right place for North Carolina. So a lot of similar good feelings.
Yeah, but there's got to be that one thing that you tried to touch and somebody said, don't touch that, or you walked up or you got into a place where you shouldn't have been by mistake in the White House.
Yeah, well, so we took our girls right on the tour of the White House, and because I have then had friends there, and they would give the girls the White House M&Ms. And so by the time we were done with the tour, they were like hopped up on sugar and chocolate and like running all over the place. And I was like, oh my God, and oh my goodness, don't touch anything. And they were little at the time. So yeah, chocolatey hands and little girls at the White House. It was a little stressful.
How did you and your husband, Sam, meet?
Oh, we met while I was training in Boston in internal medicine, and he was finishing law school at Harvard. And our best friends, mine at medical school and his at law school, we're engaged to be married, and we sort of met through them. Though they didn't really introduce us, but it was because of them that we met. And I want to say, for the record, I asked my husband out. I was the one who asked him out.
Okay. Why doesn't that surprise me?
Yeah, right. Everyone's going, yeah. And I'm very lucky. He's wonderful, and we haven't looked back.
How does Mandy decompress? Do you get that time? I imagine you have to find some time to decompress now. How do you do it? Do you read? Do you exercise?
Most of it is wanting to be outside and exercising. I'm not a huge runner, but actually have started to run again during this time period. Obviously, with the gyms being closed, I'm a gym goer, so I commiserate with all the folks who are not able to go to the gym. But I've been doing a lot of getting outside on the Greenway or at other trails near our home to just like get outside, be in nature, take a deep breath of clean air outside, and do a lot of walking. So there's a lot of walking, a lot of walking to let me process what's going on, and just listen to the birds chirp. No music, no anything. Kind of just deep. That's what's helped me.
But you are a music fan, though, right? You're a music lover. If I was going to look at the CD collection in your car, what would I find?
Ooh, so you'd probably find a lot of musicals. So I do, yes, I like the normal pop, and who doesn't love Beyonce, and some other powerful women. But I also can't resist a good musical, and Broadway is a fan. And I should say I have some folks in my family who are Broadway performers, and so wow. That's a fun way to sort of escape and live through their exciting life, which is very different than mine.
Well, that's cool. I'd read that you were a music fan. I didn't know that you actually had that in your family, though. Some musical
That's
performers.
Right. My brother is a professional French horn player in Manhattan, and his wife is a Broadway performer. Yes. So
how cool is that?
Yeah, right. A lot of talent in the family, and it's fun at family event at family events.
Yeah,
So it's
you have built-in entertainment at your events at the house.
that's right.
Your time is very busy, but someone wanted me to ask you this question, and we
Okay.
get a lot of information in your news conferences. But now that summer is coming here, somebody asked me if they've got family coming to North Carolina for vacation, if they live here, should they be tested to make their visitors feel better? Would you
It's
suggest
hard.
that?
So what I would say is if I would, what we are recommending for testing is really anyone who has symptoms. So clearly, if anyone fever, cough, right, get tested. And if they've had a higher risk exposure, so did they go to one of the protests? Have they been to a mass gathering? Did they go to a church that is now meeting back in person and it's a large group? Any of those risks, I would say yes, they should go get tested before they see their family. But if they're generally being careful, if they work from home, they're wearing face coverings, they're waiting 6 feet apart, washing their hands, they're doing the 3 Ws like Dr. Cohen says, then
I knew you were going to get that in the conversation somewhere.
Can't help it, John. Right, if they're doing those things, the likelihood that it would be very low. So a test wouldn't really do anything. And look, and every test has a false positive. So you'd be overly reassured by a test. In those settings, I'd say no, testing would not be something I would do. Again, if you have a higher risk exposure, I would get a test. If you're mostly do not have those kinds of exposures, I would say testing isn't really going to give you the sense of security that you'd want, and that you should really be doing the social distancing that we recommend.
We're going to be dealing with this for the rest of the year, correct? Likely?
Oh yes, we will. We have to live with this virus until there's a vaccine, right? Or some breakthrough in treatment that we're seeing. And I'm still hopeful that there will be those things, but we need to hope for the best and plan for what I see as the reality. And so, yep, I think that this is going to be with us. And how do we learn to live with it? And that's all the kinds of rules and guidance that we're trying to think through so that we can live with this virus. I am particularly focused on getting the kids back to school. I think that's really important, not just selfishly for my kids, but for all the kids of North Carolina. I mean, that's so critical. They need to be back in school, and we're learning more about kids, and what this virus means for them. And so I think it is lower risk, and so that is something we want to prioritize in getting kids back to school.
But and I've had this conversation with people. A college student, maybe even a high school student, they can be more apt to be able to learn remotely. But an elementary school student and a middle school student, the socialization is so important, and they're not getting that right now. And I'm wondering if 2, 3, 4 years down the line, we may see some impact on that.
I don't think we know. I mean, I definitely agree with you. We want kids to have that in-person experience. We know from data, particularly in early childhood, brain development is really about that facial interaction, and so you cannot substitute that for a screen. And so we agree with you that in-person social aspect of this is really important, which is why top priority. Let's get our kids back to school, which is why you have to do the what? 3 Ws.
3 Ws. I really appreciate you taking the time, Dr. Cohen. You have been on every newscast across the state. You've been on NPR. You've been on national newscasts as really kind of the face of North Carolina's effort. I appreciate you letting us kind of pull back that curtain and letting us learn a little bit more about Mandy Cohen, the wife and the mom, along with Mandy Cohen, the Secretary of NCDHHS.
Well, thank you. It's a pleasure to be on. And I know people are getting weary of the virus, but hang in there. We'll get through this together.
A big thank you to Dr. Mandy Cohen for sparing some of her very valuable time and joining us for this week's podcast interview, sharing her thoughts on life during this pandemic and precautions we can all take to help stop the spread of COVID-19. If you'd like to read more about her background and her career, you can find that all on her department's website. That's ncdhhs.gov. And when you'll go there, you'll see all of the information Dr. Cohen spoke about related to the COVID-19 case numbers and information to help stop the spread and keep you and your family safe. Now, before we go, I'd like to ask you a favor. Please download and subscribe to the One-on-One with John Evans podcast on whatever app you use to listen to your favorite shows. And if you would be so kind, please leave us a rating or a review. The more feedback we have from people like you, the higher we'll be listed on the apps, and the better chance we'll have of bringing in even more new listeners. I'm John Evans. Thanks so much for joining us for this week's episode of One on One. Stay safe.